If you've ever had a big medical procedure, you've definitely heard this command before. Nothing to eat or drink after midnight. For heart patients, it's been the law of the land for decades. But what if this tradition isn't just unnecessary? What if it's actually making things worse?
Yep, that's the one. It's one of the most common instructions in all of medicine. But that one simple rule is all about preventing a very specific and, yeah, a potentially very serious risk. So the main idea is to prevent something called aspiration. That's when stomach contents get into your lungs while you're under anesthesia. It is a serious concern for sure. But here's the catch. The rule was created for a type of surgery that is worlds away from many of the heart procedures done today.
So could this be just an outdated tradition? To figure that out, we've got to go back in time to see why we ever started fasting to begin with. Turns out, it's a practice that's deeply rooted in the history of anesthesia itself.
Okay, so the no food after midnight rule, it was made for general anesthesia. That's the deep knock you out cold sedation for major operations. But a ton of modern cardiac procedures like catheterizations, they use a much lighter conscious sedation. The risk of aspiration is it's a whole different ballgame. And yet, the fasting rule has stuck around. And this brings us to a huge new scientific review that decided to put this old assumption to the test. Researchers basically asked a really simple question. What does the evidence actually say? To get a real definitive answer, they did a study of studies, which is called a meta-analysis. They pulled together the results from 7 huge trials, pooling data from over 2,500 patients. When you do that, you get a much more powerful and much more reliable conclusion. So this central question was super simple and direct. For patients getting these heart procedures with lighter sedation, did letting them eat and drink beforehand actually lead to more complications?
All right, let's get into the findings. First up, nausea and vomiting. That's a key red flag for aspiration risk. Well, the rates were pretty much identical between the two groups. In fact, if you squint, the non-fasting group actually had a slightly lower rate.
But what about the biggest fear of all? Aspiration pneumonia. This is where it gets really stunning. The rate of chest infections in the non-fasting group was less than half the rate of the fasting group. I mean, this result just directly challenges the entire reason for the rule in the first place.
And that pattern just keeps going when you look at other serious outcomes. The risk of hypoglycemia, that's low blood sugar, was lower for the patients who ate. And even short-term mortality was a little bit lower in the non-fasting group too. So the bottom line from all this data was crystal clear. For these types of cardiac procedures, not fasting did not increase the odds of nausea, pneumonia, or any other major problems. The fear that we've held on to for so long, well, it just wasn't supported by the evidence. Now, in the spirit of full transparency, there was one finding that went the other way. The rate of kidney injury from the contrast dye was a little higher in the non-fasting group. Researchers think this wasn't from the food itself, but from other hidden factors they call unmeasured confounders. So what does that actually mean? Well, in simple terms, it means things like how a patient's kidneys were doing to begin with, how much dye was used, and especially how hydrated they were. Those are probably the real key players. The evidence really suggests that making sure a patient is well hydrated is way more important for their kidneys than whether or not they had a light meal.
Okay, so beyond all the hard clinical safety data, the study also looked at something that's just as important, the patient's experience. I mean, if fasting isn't making things safer, is it just making patients uncomfortable for no reason?
And the answer there was a resounding yes. Patients who were allowed to eat and drink felt so much better. They reported being less hungry, less thirsty, less anxious, and less tired. Big surprise, their overall satisfaction with their care was way higher. So when you put all of this evidence together, both the safety data and the patient comfort data, what does it all mean for the future of medicine?
Well, this massive study comes to a really clear conclusion. For many of these cardiac procedures, routine fasting is basically a tradition that causes a lot of discomfort without giving any clear safety benefits in return.
The authors of the study use a pretty powerful word in their conclusion: disparity. There's a great difference, a growing gap, between what many hospitals are still doing out of habit and what the new scientific data is telling us is best. And that leaves us with one last really important question. In an age of personalized medicine, isn't it time to finally replace a rigid one-size-fits-all rule with a more flexible, evidence-based approach that focuses on both patient safety and patient comfort?